Sleeping sickness is also called human African Trypanosomiasis. We find it in the Western region. That is northwestern Uganda, Western region. We have a form of sleeping sickness there. Then you also have in the northeast. Although these cases are reducing and it is a target for elimination, but we still need more promising diagnostic kits to help us eliminate the disease. So what we are doing is we have been working on this project. We started by getting support from the Wellcome Trust through Makerere University Stroke Uganda Virus Research Institute Infection and Immunity Training Center. That is what they call MUI Plus. When a person has been diagnosed with sleeping sickness, the treatments differ because we have two stages of the disease. The first stage is we have parasites in the blood. Then after some few months, the parasites go in the brain, and it is very hard to treat parasites in the brain. Because of that, treatment for the early stage, which is where the parasites are in the blood, is different from the late stage when the parasites go in the brain. Therefore, before treatment is commenced, they need to do a lumbar puncture. You have seen the lumbar puncture before. They will puncture in the vertebrae and they get what we call cerebrospinal fluid. This technique is very painful, and also it requires well-trained personnel to carry out. So because of this, always the patients are not willing to undergo the lumbar puncture, and also when the person who is trained to carry it out is not around, then the patient is going to wait longer to get the necessary treatment because they have to decide which treatment they are going to give. And if you select a wrong treatment, then you are going to get it wrong. Either the patient will not heal, or the patient is going to be given drugs which may lead to toxicity. Because the drug we use to treat the late stage when the parasites are in the brain is somehow toxic. And also when someone has healed, we keep on following these patients to see if they have cleared the parasite. So they keep on getting several lumbar punctures, which is not good. So now our innovation is we want to use blood. Why don't we use blood instead of using cerebrospinal fluid? So we are funded by MUI Plus, and we got a collaboration with the University of Geneva, and we still identified biomarkers. So we got biomarkers that can help us to stage in plasma or in blood. So we have already identified those biomarkers, and now using resources from the European Union grant called the EDCTP, we are now carrying out a clinical validation, where I say that we use a large number of samples from a clinical setting to test the markers that the government of Uganda has given